Yeah, so do you think the reason is, and I hear this all the time too, like so many people I know have relapsed, do you think the reason is because the first part of that, they're having to detox. And so then they're trying to get to this normal space after detoxing, and that really only leaves a couple, if you do a 30-day program, that really only leaves like, a couple of weeks to then start doing the work, the stuff that is like rooted down to your core.
Right.
That's where
I'm not quite sure what you're asking.
So I'm just wondering if you think that the reason why that maybe there's so many relapses that we hear about is that the first time around, it doesn't give them long enough time, which is what you do.
No, it doesn't. No one ever spends long enough first time around.
Because they're not dealing with the issues.
They just hadn't. I think it's in the disease. I mean, if somebody's really desperate, they will spend the time. But it's not the average patient that you get that is that desperate. They understand they're going to die if they don't get it together. And so part of addiction is having an addict brain, and that addict brain talks to them, tells them what the right thing to do, helps them, causes them to think. Again, thinking is the problem in addiction. They can figure it out. They can handle it. They're better now. They're going to control it. Whatever it is, it's always the same thinking, and then they have to try it themselves because they, part of the addictive process is not liking to follow directions, and so they don't, and that's how they get into trouble.
Do you think it's the mental health first, and then that's the coping mechanism, or do you believe people are born alcoholics?
Well, there's absolutely no question about the genetic. Genes are necessary but not sufficient for this disease, right? So you have to have the genetic potential for it. I mean, when you look at opiate addiction, for instance, you at least have to feel good when you take the opiate. You have to like it. And a lot of people are aversive to opiates. That's not going to be an opiate addict. And so alcoholics already have a very positive setup from alcohol biologically. And they have this second problem, which is a reward system disorder that distorts their motivation. Literally takes over the usual motivation, the usual primary motivators associated with survival, working, loving your family, taking care of your health. All those motivators are pushed aside and one motivation takes over, and that is the using. And so all the other great functions of our brain, our thinking, our feeling, our philosophizing, our cognitions, all serve a broken motivation. And even though they might not be craving, they might not be thinking about it, the motivational distortion, once you throw the switch, so to speak, on the disease, is always there. That's why they go back, because that is always in the background. You see it more vividly with some of the more severely addictive substances, like meth and cocaine or heroin. Which is, I have patients all the time. They're 3 months into treatment and they go, I got to go back and clear out my apartment. The landowner says, there's one day they'll all of a sudden go, I got to go back to San Francisco. I got to clear my apartment. I got to get up there. The landlord is going to throw my stuff in the trash. And just because it's that person saying it, I know there's something wrong. And because they hadn't said it before, and all of a sudden that morning they're saying it. The patient doesn't know it. The patient literally is worried about the rent or the material in the apartment, and we'll sit down with that person and go, why now? Why all of a sudden? Why don't you send your brother? Why don't you send you have friends up there? Why don't you have them clear it out? Oh no, only I. Okay, so we know immediately that's the disease. The patient doesn't know it. The last time I had a patient say that to me, it literally was San Francisco, and it was an apartment that had to be cleared out. She was slamming heroin before she left the airport in San Francisco, and there it is. It just operates on such a pernicious level. So that's the motivational. That's the biology of addiction. It's a biological, neurobiological process that is outside of volition, outside of cognition, outside of everything else. It's in the nucleus accumbens, actually the shell of the nucleus accumbens, in the genetically prone. And when those ventral tegmental cells are firing at an extra physiological rate, those cells change permanently. And now you've got it. And then you have to do something about it. And you have to do something active because it's there every day, affecting your thinking and your feeling. And it settles with time, but a long time. Now, you asked after this little diatribe I just went into, you asked, is mental health primary? Well, if you have, I ran a program in a psychiatric hospital, and we could handle anything, no matter how sick the patient was, provided they didn't need a ventilator, we could handle it. And we got that reputation over the years, and we would say the sickest of the sick. Now, in my world, those patients, those patients always have trauma. And I said that to a friend of mine, a very fine psychiatrist. He said, don't say always, don't say always. I said, okay, 100% of the time, my patients have trauma. 100%, never an exception. That's the way it goes. So trauma is essentially the rocket fuel of addiction. And as I mentioned before we started really talking here, that interpersonal neurobiology is my interest because trauma is what is interfering neurobiological development and the usual capacity for emotional regulation. And when you are traumatized, you exit that frame of closeness with other human beings that allows us to build emotional regulation. And you won't get near the people that way because it's too dangerous, too painful. And now you look out into the world for solutions to this pain and this dysregulation and the trauma. And the things that the world offers you include drugs. You find them, they work, and now it's on. And every addict I've ever treated always tells me how this worked for them. It was great, it worked, until it didn't work. It made them feel worse. It made everything worse. And yet this thing had been thrown, so now they can't stop. So you have to treat the addiction first, and then somewhere down the line, depending on the case, you start to deal with the other stuff. And by the way, after the long periods of time of using, you now have other neurobiological problems. Hold on one second. Sorry. My wife is just texting the heck out of me. Now you have other neurobiological problems from brain injury, from neuromodulating problems and neuroreceptor changes, and now you have a whole separate set of problems where you can have psychiatric symptomatology just from the drugs. So all that must be treated early in order to make recovery possible. I would caution people not to diagnose addicts early in their disease, but treating mood disturbances and things can help make recovery possible.
What do you think that we can do for people that maybe before COVID didn't feel like they had a drinking problem, and now that they do you think 12-step recovery program is the way to go, or what do you
So the same John Kelly that I mentioned a while ago published a Cochrane analysis. He with Keith Humphreys at Stanford. They have a Cochrane analysis that shows the mutual aid societies of all types are as efficacious or more when abstinence is your goal for treatment of substance use, particularly alcoholism. And it's free, and it's available 24/7, and it's available everywhere, and you could go to a meeting right now. And in a time when there aren't enough mental health professionals to deal with what we've done to ourselves, both with the trauma and the COVID and the substance using, these things are available everywhere, all the time, and they're free.
Yes.
Did I mention they're free? They're free. Take advantage of this. If you are not taking advantage of it, there's something wrong. In other words, if you need treatment and you start making exceptions for that's your disease. The making of exceptions is the disease talking to you. Because if you really want to get better, you should be willing to do whatever it takes, and certainly take universally available, constantly available free services that are out there for you to reach out to. They'd love to have you.
Yeah. Oh, I couldn't agree with you more. And that's what I did. And I didn't know anything about AA. And I knew one person that didn't drink. And I reached out to him and I said, hey, this is what I'm going through. And he said, I'm going to an AA meeting. And I went for the first time. And then I just went every day. And, I was a single mom. It's like I couldn't go to treatment or anything, but I had to stop drinking. I knew 100% I had to stop drinking. And
you did.
It's free.
It's free. It's free, and it works. And so, why would people take issue with that? Why would we assail that? It's insanity.
It really is. And they have them every hour somewhere in your city.
Well, and in the day of Zooms, it's ridiculous if you don't want to go. You don't have to show yourself on camera if you have some feeling about it. Just go. But I don't want to leave out though. But be careful. I'm not saying that people don't need professional services. I'm saying you can get going right away. You'll know pretty quick if you need other help. And the trauma treatment and the sort of the more microsurgery that needs to be done down the road, that is better done later. First of all, your brain has to clear, number one. Secondly, getting to close to the action or being evoked in ways becomes a good excuse to relapse. And again, people will use any reason to relapse. And you're and you got to get the first things first.
Yeah.
The first thing is getting this disease you've activated under control.
Right. And do you think that, so for me, I was like praying, please take away the desire, because I wonder if people relapse because they still have that desire. I mean, that desire was taken away from me in a matter of 2 weeks. I've never had a desire again. Do you think that that's another reason why people relapse? They have that desire, they want that taste?
Yes and no. Yes and no. I think too much is made of cravings. I think way too much, because the patients I have the most trouble with are the ones that don't have the cravings, because they think they got it all together. It's fine. I'm fine. Why do I go to meetings? I don't want to drink. I don't want to drink anymore. But the motivational problem is still there. See, that's what people don't understand. They think, oh, you want the alcohol. No, your brain has been usurped and pushed in a certain direction. So you, that has it all together, will start thinking it's a good idea to go test yourself at a bar, go hang out with your friends, because I've got it together. Relapse. And sometimes that relapse is because the cues cause the stimulation of the desire and whatnot. But more often than that, it's well beneath consciousness. More often than I cravings, patients that have lots of cravings go to meetings. So I welcome cravings. It lets you know your disease is alive and well.
Okay, interesting. So is I know that you're also involved heavily with the homeless community. Is it part of that because you do understand addiction and the mental health aspect of it? Because I
most of my patients ended up homeless. That's part of the disease of addiction. I'm walking by people. It's literally like I'm a surgeon that knows how to do this very specialized procedure. I've got patients lined up on the sidewalk and nobody will let me touch them. And that's what it's like for me. I see my patients essentially everywhere. This is all drug addiction, and I wasn't even convinced it was as bad as I thought it was until the other day I went down to Skid Row. I walk it once in a while with Andy Bales from the Union Rescue Mission. And I heard how people were talking. I went, oh my God, it's all addiction. It's just, and I asked the girl, I said, when was the last time you had somebody in the mission that wasn't addicted? They couldn't remember. Yeah. I was like, oh my God, it's that's the primary problem here. That's it. There's other stuff. Don't get me wrong. But the substances, no matter how they get there, I don't care. It has to be treated, and it's keeping people on the streets and taking people to the streets and killing people at a rate, just in this county, in Los Angeles alone, 6 people a day. 6 a day. It's ridiculous. It's absurd. Yeah. It's insane. It's so insane.
Awful here in Austin too. What do you think is the difference between somebody on the street and a fully functioning alcoholic CEO?
Really hard. I don't know that I could. It's an interesting question. I really never thought of it quite that cleanly. I always feel like, alcoholism, heroin and meth take you to the street very, very, very quickly. And it's part of the scene. It's part of where your drugs are. You love your drugs, and so you're going to go where they are, and you just sort of stay there. And alcohol is a little different. By the time alcohol takes you to the street, you've had that slow deterioration, and you usually have lots of medical problems by that point. Your brain is just not working right, and people have abandoned you. You start losing work. It's just that slow roll. And if people go all the way down the hill with alcohol, eventually they lose everything. That's the way it works.
Yeah, it does. Wow. I appreciate you talking, Kelly, on that. I'm just so curious about it. And I just have so many friends that are suffering, and, you want to do whatever you can. But ultimately, at the end of the day, they have to help themselves.
So you said the magic words to me. What can I do? I'll do anything. There is only one thing you can do that makes a measurable difference. And that is go to Al-Anon, get an Al-Anon sponsor, and work an Al-Anon program. That affects the person you're worried about. It changes how you engage with them. But I cannot tell you how many people say that to me. I'll do anything. I just want to help. I got this one thing. And I'm not saying, watch your fat intake and let's monitor your blood pressure. I'm saying this thing will make a difference, and it's the only thing. Nobody ever does it.
Are you serious?
Yeah, or they do it occasionally. And when they do, it works, and that's it. So,
So you think
it's so odd to me.
So you think so I never heard this before. So in order to help, you think it's best to go to an Al-Anon meeting and learn that side of it?
This is an interpersonal disease. Much the way it affects the motivational, all the systems in the individual's brain that has it. It engages the emotional systems in others. All that manipulation and all of the fantasies of the person dying, all these things that you feel, or the aggression or the chaos, whatever it is, the vortex of drama, all that is enlisting you in the disease. When you're close to somebody, the best model for codependency and addiction that I know of, it is the plant in the Little Shop of Horrors. Do you know what I'm talking about?
Yeah.
The Audrey 2.
Yeah.
You go near the plant, it eats you. The only way you can get out of the plant is having somebody there pulling you back, Ariadne's cord. And that's what Al-Anon is. It's you checking in with somebody like, hey, he's saying to me he's going to die. He's got tuberculosis. He's got alcohol. He's going to die if I don't give him $100. And he promises me he'll go to the hospital as soon as I get that money. Well, how can you not do that by yourself? You're somebody you really care about. Somebody outside of the relationship has to go, he's done that 4 different ways to you. He's not going. You're going to have to stand firm. Yes, he has alcohol. Yes, yep. He has all those things. He's going to drink with that $100, and you have to stand firm. And it's impossible by yourself. It's impossible.
Yeah.
Especially if you really care about the person, they'll get you. And I know even when I'm working with patients with All I Know, I have to bring a nurse in the room with me, not because I'm fearful of what they're going to say. It's because I'm afraid I'm going in the plant. And my nurse used to have a code. She'd kick the back of my chair when she saw my codependency acting up, and it would pull me back out. And you don't even realize it's happening when it happens. It's an uncanny disease in how it affects the one person with it and the people around the person with the disease.
I appreciate you just talking and being open about your codependency because, I know a lot about it, but how many people do you think actually struggle with codependency and we don't even know?
Well, it depends how codependency is not a diagnosis. It's kind of a construct to help understand a constellation. It's not even a syndrome, really, but it's a constellation of phenomena, not even a constellation of symptoms. Anybody that had to really anybody whose survival and well-being during their childhood required them to focus on their parents to make sure things were okay and not being given what they needed by the parenting figures. That's codependency. That's where it starts. And I'd say that with alcoholism addiction is 15-20% of the country, so definitely there. And there's plenty of other insufficiencies that we're rendering in parenting that people don't, because our boundaries have been bad and we've been traumatized, and people don't understand the impact of what they do to kids. It's only slowly coming into focus now. So we have a lot of codependence running around, and trauma, of course, creates it, because trauma, you just go into survival mode and you're trying to control everybody around you.
Right. Yeah. What do you think? With it's 1 in 4 people, they say, are dealing with depression. Do you see that those numbers probably even are skewed, and it might be more than that because we don't even really know? Okay.
Definitely.
Okay.
Definitely more than that.
Okay.
And especially post-COVID. I mean, there's just, talk to anybody. I don't know anybody that doesn't complain about their affect right now. Or at least in 2021, they complained about it a lot.
And what do you say, or how can we help our audience right now if they're experiencing, sadness on a regular basis? How do we determine? I'm sorry, let me rephrase this. How do we determine if it's somebody? Hold on, pause. Okay, here we go.
Yeah, you're going to ask me, how do we know it's just some transient blues, or is it really depression?
Right, and how do we know?
That's hard.
Yeah, to let them know.
It's hard.
Okay.
It's hard. The simple construct is around functioning. Can you function? Can you function interpersonally? Can you function at work? Can you function medically? Are you functioning? Are you okay? If you start having trouble functioning in any of these areas, this is what we tell the alcoholics or the addicts too. worker school, financial problems, legal problems, health problems, relationship. Did I say that? Relationship problems. That is something to pay attention to. If you have a family heritage of depression, if you've had depression previously, you have a 50-60% chance of recurrence. So if you're diabetic, it increases your probability of depression. So there's all kinds of things that increase the probability that what you're feeling is a depression if it's persistent and not sort of lifting. Yeah, but whatever it is, I would immediately. Sort of the principles are kind of the same, which is, well, first of all, make sure you can function. Obviously, if you can't, that's time to see the doctor. But if you can function and you're worried you have stuff, there are things you can do, and really, for me, engagement is one of the key things. Get going with service, leading a good life, being around and with other people, engage with other people. If you have a spiritual life, get in the life of faith and engagement. But it's really about us with other humans. That is how we regulate. That's how we find meaning. That's how we heal ourselves, our brains. Just get out and do things with people, particularly people that care about you. So to me, that's a major piece of recommendation, and that's why meetings work. It's why 12-step work. But if you can at once find a way to engage and purpose and have some sort of higher power, some sort of connection with something bigger than yourself, whatever that is, you're on your way.
Okay.
On your way.
And what can people do who have friends that are going through something? So I know a lot of people. So my friends at one time, they didn't know how to help me, and a lot of friends feel like that. If their friend is really struggling, or a family member, or what have you, what can other people do to help support their friends that are going through something?
Well, it depends. In your case, you said you had a substance issue, and if there is even if you suspect a substance is the problem, go to Al-Anon. Go to Al-Anon, get a sponsor, reflect with that person what happens in every encounter with the identified patient, and make sure you're kind of got your boundaries clear and you're doing the right thing. I cannot be clearer about that. I'm telling you, it works. You can get your own therapist and pay for therapy to help with that. I mean, that's not as efficient, frankly, as Al-Anon, but that will help a lot. Beyond that, it's about being there. It's about being there and being open and expressing your concern. And rescuing is not often what people need. They just need your full attunement and presence and caring. And that's it. It's about sitting there and being present. And beyond that, I mean, obviously, if somebody has a dangerous problem, you have to, break through their denial, and it's hard to do. Just keep reflecting. If you're really worried about somebody, keep reflecting what you're seeing. There's a great technique that everyone should get very good at. Well, first of all, use lots of humor. Humor works great. Mm-hmm. But the other thing is wonderment. It's a very non-confrontational way of getting through people's defenses or denial, which is, Julie, I'm wondering, gosh, I see you with 2 glasses of wine I'm wondering if you're drinking more than that. Do you think you are? Mm-hmm. Just boom, that's it. I'm wondering. Lots of wonderment, and of course, your wonderment is not real. You know the real answer. Julie's drinking more. But Julie will, even when people know that you're using wonderment, they can't resist. They can't resist kind of going forward, going, you're right. And then if you laugh about it a little bit, more information will come. And then you can kind of look at it and reflect about it.
Okay. Yeah, I hear, a lot of people want to try and fix the problem. And I used to be that person too. I want to be the one that could fix it.
Al-Anon, I was that person too. I was a big rescuer. That was one of my misadventures as a clinician. I would try to fix and special understanding and be the best I possibly could be for that patient. Wrong. They need standard of care. They need good care. They need me present. And that's it. They need my boundaries clean. One of my goals always in treatment was to get people into a therapeutic frame, into a frame of closeness. Because if everyone's traumatized, they won't come in, as I told you. And so one of my jobs is to just get them in and to hold them there. And that is not rescuing. That is being present.
Okay. Yeah, it really is. Closing things out, I would love to know what you do and what for you personally to help your mental health and what you recommend to others.
Well, I told you I had lots of professional services, and I would just say in the loudest possible terms, treatment works. Treatment works. Beyond that, it's the basics. You want to avoid hungry, angry, lonely, tired, right? You want to, physical health is important. You work out every day, sleep right, nutrition. I mean, these go a long way in our mental health. Mm-hmm. And pay attention and fix things you can fix, and keep your priorities lined up, and try to find outlets of where you can make a difference and create meaning. We are meaning making machines. That was Viktor Frankl's big insight, and he is absolutely right about that. And to the extent that we can contribute to others, we're and the other thing is pay attention to gratitude. If you're not feeling grateful, something might be up. And if you are feeling grateful, it's a great sign. It's a great sign that things are good. Okay.
And are you a fan of meditation?
I am a fan for others. I am not personally. I have to be. I'm one of these people now. So 20% of people get worse from mindfulness. Now the people that I know they're real advocates tell me that's just a phase that people go through until they really learn how to do it properly. And I have no reason not to believe that. It's just not for me. It's not for me, but it is for many, many, many. And I strongly agree with that.
Okay. I was just curious.
Yeah.
Well, I just can't thank you enough, Dr. Drew, for being on today. I just, you've provided so much insight into your own life and to help others. So really, I just want to thank you so much.
Yeah. Good. And keep doing what you're doing. It's a worthy, like you're doing exactly what I'm talking about. So let's, grow and build and connect and raise awareness and get people what they need to thrive.
I love that. Okay, great.